back to my channel. So today's video, I'm gonna actually talk to you guys about my chemo, my surgery, possible surgeries, and my radiation, and then what could possibly come after. So I'm gonna dive into talking about the meds that I was told I'm gonna be given for chemo. So Taxol, carboplatin, and Keytruda. Keytruda is not a chemotherapy, it is immunotherapy. And then adriamycin and Cytoxan. So those are just the names of it, and then I'll get into what they are in a minute. First, I'll start with pre-meds. I will be taking, so when I get to my chair, so I'll go in, I'll get blood work, go see my doctor, then I'll go back, sit down in my chair, and start my infusion. And starting from there, I'll be having my pre-meds, which takes about 30 to 45 minutes. I'll be getting Benadryl, Aloxi, Amend, and I always forget that one, and Decadron. I have my papers all right here, so if I look down, I do apologize. And so those 4 meds combat nausea, and they keep me from possibly having any reactions, especially to Taxol. Taxol, you can get a reaction either your first or your second one, and sometimes even your 6th one. So right now, I'm just hoping I'm the 50-50%, I'm the one that doesn't get the reaction. So, because that'd be great. If you're allergic, then you have to switch to a whole new drug, and I really don't want to do that. So, fingers crossed, because I'm already used to what this is all says, and I don't want to change. Okay, so I'm going to jump into the side effects of my medicines. So after my pre-med, then I'll go into Taxol. Taxol I'll get for approximately an hour, and I'll be wearing mitts and booties during that, and that's where it's the cold packs, and just to possibly prevent neuropathy. So it's not going to be fun. I'm going to be really cold, and it's probably going to hurt a little bit. They said it might even burn. So it is what it is, as long as I don't get neuropathy, right? So Taxol. The side effects, again, I'm going to be looking down the paper, is bone marrow suppression, abnormal EKG or ECGs, soreness of the mouth and throat, so you can get sores in your mouth, you can get white patches in your mouth, and you can get red areas in your mouth. They're all very painful. So as long as you keep your mouth wet, moist, hydrated, keep drinking fluids, you should be fine. And don't suck on anything sugar candy wise, because that will cause dryness. There's nausea and vomiting, diarrhea, abdominal bleeding, swelling of the hands, feet, and any other part of the body, changes in your liver function, infections, bone, joint, and muscle pain, neuropathy I've already talked about, so don't need to go into that, and then hair loss. And there is, like I talked to you before, the allergic reaction, which is anaphylaxis. Then there's flushing, trouble breathing, swelling of the throat and tongue, fever, chills, feeling dizzy, your heart beating too fast or your heart beating too slow. So if you feel any of that or anything that doesn't feel normal to your own body, then you need to tell your nurse immediately. They'll stop your drip, start giving you a saline flush. And if that doesn't start helping immediately, then they'll give you some type of meds. For me, it would have been like Benadryl to stop the side effects from happening, the allergic reaction from happening. And if everything goes well, then they'll start the Taxol back up, but it'll be at a slower drip. So that is Taxol. Carboplatin, I'm only going to mention what I haven't read, because a lot of these are pretty similar when it comes to side effects. So for carboplatin, I will be getting that for about an hour as well. That I do not have to wear my mitts and booties for, so I'm actually really grateful about that. So possible side effects are decreased appetite, weakness, changes in your liver function, electrolyte changes, pain. So pain can be anywhere in your body for this one. And The next one is Keytruda, which again, I mentioned is an immunotherapy, not chemotherapy. I'll get that every 3 weeks for 1 year. And that one should take about 30 minutes. And the side effects, they may be similar to the other two. I'm going to read these ones off just because it's a completely different thing. So, nausea, diarrhea, constipation, pain in your abdomen, tiredness, fever, decreased appetite, changes in your thyroid function. So, if you get, told that you need to get your thyroid checked, that is why. It doesn't mean something's wrong. They're just checking it. Muscle and bone pain, again, pain anywhere else, all over. Trouble breathing, cough, rash, and itching. Again, you can get all these side effects. You can get none of these side effects. You can get one side effect. It's always going to be different. And I have mentioned before in other videos that I have a group of girlies that I talked to that were all going through the same treatment, and they have been blessed. So far, they've been so blessed, and God willing, they keep being blessed because their side effects have been, very minimal. They've had fatigue, muscle ache from overexertion, a little bit of nausea, and headaches. I mean, that's not that bad. I'm sure it was bad going through it, but it's out of everything that you could be given, that's pretty good. And they're blessed. And I hope that I'm going to have the same, feeling afterwards as they did. So that way I don't have to go through all this scary stuff, because it was very traumatizing to read. And I'm sure other people can understand if they've had to read these papers. It really messes with your mind. So that is those. I will have Taxol, Cobalt, and Keytruda for 12 weeks straight. Now, again, God willing, nothing goes wrong. I don't get any infections or my white blood cell count is too low. Then I would have to skip a treatment and wait till I'm better, possibly get a new Lesta shot, and then I can go back to my infusion schedule. So that is that section. Then when I'm done with those two chemos and then immunotherapy, then I'm going to be going to 4 infusions. Okay, they'll be 21 days apart, and that's going to be the AC, adriamycin and Cytoxan. Yes, I'm sure you know what adriamycin is. It is the red devil. It's red, and you pee red. It's a very hard one, and that's the one that really does like to attack your hair, which again, I'm going to read you what they are. For these, I haven't been told how long it'll take for me to receive some of this, just because I'm not there yet. Not tomorrow, on the 10th is my first infusion, so I'm nowhere near close to it. I do know that my adriamycin, I'll be getting over a 20-minute span where it'll be them holding it, and they'll be slowly putting it in as salion's going through me, and it'll be very slow for about over 20 minutes. Then Cytoxan, I don't know how long that one's going to take. It could take anywhere from an hour, less, I don't know. When I do know, I will let you know. And then if on those days I end up being my 3-week mark for Keytruda, I might have Keytruda along with it. I don't know yet. So I'm hoping not, because I think 2 is enough. 3 is already enough here, so I think 2 is enough for this one, because this one's pretty harsh on you. So we'll go with adriamycin first. Side effects are sores of the mouth and throat. You may have red areas, white patches, or sores that hurt in your mouth. And I already told you what you could possibly do for that, and I'm sure so is your doctor. Nausea and vomiting, most times it happens. Diarrhea, and then, like I said, hair loss. Now, when I mention hair loss, before I go on, hair loss can be anywhere. I'm talking eyebrows, eyelashes, under the arms, the pubic area, the legs, you're everywhere. So wherever there's hair, you can lose it. So whether it's on your head and your hair thins and you get patches, or you lose all of it, it really just kind of depends on your body. And also, some people do cold capping, some people don't. I took the route of not doing that, and I shaved my head because I've shaved my hair before, pretty short, not bald, but like short, and it didn't really bother me. So when we fully shaved it, I thought it didn't bother me until, like I told you guys in a different video, that I was told by my doctor that yes, she would write me a script for a wig, which I'm still waiting on. And so I do miss my hair, and I guess I should have looked more into the cold capping route. I didn't, because I didn't really know much about it. So, there's that. I wish I could have, but it is what it is now. So that is the side effect for adriamycin. And as for cytotoxin, it's decrease in the number of your white blood cells. This may raise your risk of infections. So that one's a little bit scary. So for any of these, I will say that if you ever get a fever of 100.4, you have to hurry up, call your doctor, and see what they want to do. If they want you to take Tylenol at home, see if it comes down, or if they want to bring you in immediately because your white blood cell count is too low to where you need to be in the hospital for them to, bring it back up and get you going. Fever, and I can't pronounce this word, but I'm going to try my hardest. Neurotropenic fever, a type of fever that can develop when you have a very low number of white blood cells, which can be life-threatening. Nausea and vomiting, which, yeah, diarrhea, and then again, hair loss. So really, it's not that too much different. It's a little bit more scary, just, you can get infections from it, but that's a possibility with really any of these. So that's what the side effects are for this. And as for with my girlies I talk to, AC side effects for them, again, weren't as bad as what all of these say, but for them it was nausea. I'm reading off the papers. Nausea, extreme tiredness, fatigue, loss of appetite, and they did get their Neulasta shot every time. So I don't know if I'll get that. I hope I do, but I also don't look forward to the side effects. But it does help you, so it is worth it, really. And she got her extra 3 side effects for extreme body aches and pains, headache, and sore throat, which again might have been because of the Neulasta and not the AC, but we won't know. But all of the symptoms only lasted for all of it for 4 to 5 days, and then she was good after. And she only had a 2-week break. I'm not gonna say any names. She had her 2-week break, and then she had to do her next infusion. My treatment is I have it every 3 weeks, so I get my 21 days in between. So that's all the chemos, that's the pre-meds, and that's also what my chat girlies went through. Now, next will be my 4 to 6 week break, and by that point, I have to make a choice with my breast surgeon whether I go the route of lumpectomy or double mastectomy. Now, I could go just remove one breast, but that would affect me, I think, more mentally, physically, emotionally, because, I'm missing one. So if I have to choose, I'm going to do double mastectomy. So right now, we're leaning more towards lumpectomy, and if my results come back from my chemo not great, then I'm going to do the double mastectomy for safety. So if I do a lumpectomy, it'll be a 4 to 6 week healing time. If I do a double mastectomy, it'll be a 6 to 8 week healing time. And then after that break of healing, I'll go right into radiation. Radiation so far could change, but as we know right now, it'll be 35 treatments. So Monday through Friday, 5 days a week for 35 sessions. And then I'll find out after that if I need, a chemotherapy oral pill for however many months, or anything else that's preventative to help me stay safe and keep this cancer gone. And then, like I said, I'll be on Keytruda every 3 weeks. So that doesn't, even when I'm done with my infusions, I will still be on Keytruda for every 3 weeks for 1 whole year. So I start September 10th. I'll end sometime around September next year. So that is all my medicine, my chemos, my immunotherapies, and that's everything right there. Then I am given meds for any side effects, and I can give you like a few right now. There's Compazine, there's Zofran, and then there's a bunch of other ones. So I have meds for nausea, I have meds for anxiety, and I have meds for pain. I'm not going to bother telling you what the rest are right now for the fact of I haven't taken any of them yet. So, and I don't know if I'm going to need them. So if I take them, I will tell you. If I don't take them, then I obviously didn't need them, but I'll still let you know. And if I took them and they didn't work, I'll let you know. But again, my body is different than your body, so it could work for you and just doesn't for me. But I don't want to give you guys, bad information. Again, like I normally say, I am not a medical professional. So take everything I say with a grain of salt. Yes, I did read off the paper from them, but your papers could be different. So take everything I say with a grain of salt, consult your own doctor, and don't take any medicine that you shouldn't take without your doctor's permission. And that's really all I have to say. So I hope you learned a lot. I hope you understand better what I'm about to go through in a few days. And I will be posting every Tuesday what I went through for the whole week. It will be like little snippets all put together, and that way you kind of see my journey of how everything went. I hope you enjoy this video, and I hope to see you guys again. So have a great day, whether it's nighttime for you or daytime for you. I hope you have a great day, great night, and I hope you all stay blessed. Getting flustered here. Bye, you guys.